Broken heart syndrome is also known as A. Hypertrophic cardiomyopathy, B. Takotsubo cardiomyopathy, C. Dilated cardiomyopathy, D. Restrictive cardiomyopathy. Correct answer B. Takotsubo cardiomyopathy. Broken heart syndrome is also called Takotsubo cardiomyopathy. It often follows intense emotional or physical stress. The heart's left ventricle temporarily weakens and balloons out. This gives it a shape like a Japanese octopus pod called Takotsubo. It usually gets better with time. Which rare heart condition is characterized by fatty infiltration of the right ventricle? A. Endocardial fibroelastosis, B. Arrhythmogenic right ventricular cardiomyopathy, C. Epstein anomaly, D. Hypertrophic obstructive cardiomyopathy. Correct answer B. Arrhythmogenic right ventricular cardiomyopathy. Arrhythmogenic right ventricular cardiomyopathy (ARVC) is also known as arrhythmogenic right ventricular dysplasia (ARVD). This condition involves fat and fibrosis replacing the right ventricular muscle. It is a rare inherited disorder. It may cause ventricular arrhythmias and sudden cardiac death, especially in athletes. Which of the following is a rare autosomal recessive disorder that presents with long QT interval and deafness? A. Romano-Watt syndrome, B. Brugada syndrome, C. Jervell and Lang-Nielsen syndrome, D. Wolff-Parkinson-White syndrome. Correct answer C. Jervell and Lang-Nielsen syndrome. Jervell and Lang-Nielsen syndrome is a rare inherited condition. It features prolonged QT interval and sensorineural deafness. It increases the risk of sudden cardiac death. Which rare disease causes myocarditis due to iron overload? A. Wilson's disease, B. Sarcoidosis, C. Hemochromatosis, D. Amyloidosis. Correct answer C. Hemochromatosis. Hemochromatosis leads to iron deposition in multiple organs. When the heart is affected, it causes restrictive cardiomyopathy or myocarditis. It may eventually cause heart failure if untreated. Which cardiomyopathy is associated with endomyocardial fibrosis and eosinophilia? A. Dilated cardiomyopathy, B. Restrictive cardiomyopathy, C. Loeffler's endocarditis, D. Takotsubo cardiomyopathy. Correct answer C. Loeffler's endocarditis. Loeffler's endocarditis is a rare restrictive cardiomyopathy. It is linked to eosinophilia and fibrosis of the endocardium. This condition can lead to heart failure. It usually affects the apex of the ventricles. Which rare congenital heart disease features a single arterial trunk emerging from the heart? A. Tetralogy of Fallot, B. Transposition of great arteries, C. Truncus arteriosus, D. Epstein anomaly. Correct answer C. Truncus arteriosus. In truncus arteriosus, there is only one large vessel coming out of the heart. It supplies blood to the body, lungs, and coronary arteries. It is a rare and serious congenital defect. Surgery is needed early in life. Which rare heart condition is caused by inflammation of the small and medium vessels leading to coronary aneurysms, mainly in children under 5 years? A. Polyarteritis nodosa. B. Giant cell arteritis. C. Kawasaki disease. D. Behcet's disease. Correct answer C. Kawasaki disease. Kawasaki disease is a rare inflammatory disease in children under 5. It affects small and medium vessels, especially coronary arteries. If untreated, it can cause coronary aneurysms and sudden death. Treated early with IVIG and aspirin. Which rare condition causes narrowing of the aorta in children or young adults and is linked to large vessel vasculitis? A. Takayasu arteritis. B. Berger's disease. C. Kawasaki disease. D. Rheumatic heart disease. Correct answer A. Takayasu arteritis. Takayasu arteritis is a rare vasculitis affecting large arteries like the aorta and its branches. This can cause reduced pulses, hypertension, and heart failure. It mostly affects young women, especially in Asia. Which rare inherited disorder leads to telangiectasia and can cause AV malformations in the lungs and heart? A. Ehlers-Danlos syndrome. B. Hereditary hemorrhagic telangiectasia. C. Marfan syndrome. D. Fabry disease. Correct answer B. Hereditary hemorrhagic telangiectasia. Hereditary hemorrhagic telangiectasia is also called Osler-Weber-Rendu syndrome. This is a rare condition that leads to abnormal blood vessel growth. AV malformations can occur in lungs, brain, liver, and heart. It may cause bleeding, cyanosis, or heart failure. Which condition presents with a mid-diastolic murmur at the apex and opening snap? A. Aortic stenosis. B. Mitral stenosis. C. Mitral regurgitation. D. Atrial septal defect. Correct answer B. Mitral stenosis. Mitral stenosis produces a mid-diastolic murmur at the apex. You also hear an opening snap after the second heart sound. It happens due to narrowed mitral valve delaying blood flow from the left atrium to ventricle. A patient with chest pain relieved by sitting up and leaning forward most likely has A. Myocardial infarction. B. Aortic dissection. C. Pericarditis. D. Pulmonary embolism. Correct answer C. Pericarditis. In pericarditis, the chest pain often worsens when lying down and improves when sitting up. This positional change helps relieve pressure on the inflamed pericardium. It's a classical clue in diagnosing pericarditis. A 5-year-old child with a continuous machinery murmur is likely to have A. Ventricular septal defect. B. Atrial septal defect. C. Patent ductus arteriosus. D. Coarctation of aorta. Correct answer C. Patent ductus arteriosus. Patent ductus arteriosus PDA produces a continuous murmur called a machinery murmur. It's heard best at the left upper chest. It occurs due to persistent connection between the aorta and pulmonary artery after birth. Which of the following heart sounds is heard in patients with heart failure and indicates volume overload? A. S1, B. S2, C. S3, D. Opening snap. Correct answer C. S3. The S3 heart sound occurs due to rapid filling of a dilated left ventricle. It's often heard in patients with heart failure and is sometimes called a ventricular gallop. It is a low-pitched heart sound heard best with the bell of a stethoscope. Which heart disease is classically associated with snowman appearance on chest X-ray? A. Total anomalous pulmonary venous connection TAPVC. B. Epstein anomaly. C. Coarctation of aorta. D. Tricuspid atresia. Correct answer A. Total anomalous pulmonary venous connection TAPVC. In TAPVC, all pulmonary veins drain abnormally, often into the superior vena cava. The chest X-ray shows a snowman or figure of 8 appearance. It's a rare cyanotic congenital heart disease. Which of the following is the earliest marker of myocardial infarction? A. Troponin I. B. CKMB. C. Myoglobin. D. LDH. Correct answer C. Myoglobin. Myoglobin rises within 1 to 2 hours of myocardial injury, making it the earliest marker. However, it is not very specific for the heart. Troponin is more specific but takes longer to rise. Which congenital heart disease is associated with egg on a string appearance on X-ray? A. Tetralogy of Fallot. B. Transposition of the great arteries. C. Truncus arteriosus. D. Epstein anomaly. Correct answer B. Transposition of the great arteries. In transposition of the great arteries, the aorta and pulmonary artery are switched. On X-ray, this gives an egg on a string appearance due to narrow mediastinum and enlarged heart. It is a cyanotic heart disease in newborns. Which of the following features is seen in Eisenmenger syndrome? A. Right to left shunt. B. High systemic blood pressure. C. Bradycardia. D. Left to right shunt. Correct answer A. Right to left shunt. Eisenmenger syndrome occurs when a long-standing left to right shunt leads to pulmonary hypertension. Eventually, the shunt reverses to right to left, causing cyanosis. It is a complication of uncorrected congenital heart defects. A bounding peripheral pulse with a rapid upstroke and quick collapse known as a water hammer pulse is most commonly seen in which condition? A. Mitral stenosis. B. Aortic regurgitation. C. Aortic stenosis. D. Tricuspid regurgitation. Correct answer B. Aortic regurgitation. A water hammer pulse is a characteristic finding in aortic regurgitation. It results from a high stroke volume followed by rapid runoff of blood back into the left ventricle. This gives the pulse its strong collapsing nature. It is best felt in the radial or brachial artery when the arm is lifted. Which valve is most commonly affected in rheumatic heart disease? A. Aortic valve. B. Pulmonary valve. C. Tricuspid valve. D. Mitral valve. Correct answer D. Mitral valve. The mitral valve is the most commonly involved valve in rheumatic heart disease. It often becomes stenotic or regurgitant due to chronic inflammation. This is especially common in developing countries with high rates of streptococcal infections. Which electrolyte abnormality is most likely to cause tall peaked T waves on ECG? A. Hypokalemia. B. Hyperkalemia. C. Hypocalcemia. D. Hyponatremia. Correct answer B. Hyperkalemia. Hyperkalemia affects the cardiac conduction system and causes tall peaked T waves on ECG. If untreated, it can progress to severe arrhythmias. Prompt treatment is essential to stabilize the heart and lower potassium levels. Which of the following drugs is used to treat supraventricular tachycardia acutely? A. Atropine. B. Adenosine. C. Amiodarone. D. Digoxin. Correct answer B. Adenosine. Adenosine is the first line drug used to treat acute SVT. It works by temporarily blocking AV node conduction, which helps restore normal rhythm. The effect is very short but effective in many cases. A 10-year-old boy has fever, joint pain, and a new heart murmur. What is the most likely diagnosis? A. Infective endocarditis. B. Viral myocarditis. C. Rheumatic fever. D. Kawasaki disease. Correct answer C. Rheumatic fever. Rheumatic fever commonly affects school-aged children after a streptococcal throat infection. It presents with fever, migratory joint pain, and carditis. A new heart murmur suggests valvular involvement, especially mitral regurgitation. A young adult collapses during exercise and is found to have a systolic murmur that increases with Valsalva. What is the likely diagnosis? A. Aortic stenosis. B. Hypertrophic cardiomyopathy. C. Mitral valve prolapse. D. Pulmonary stenosis. Correct answer B. Hypertrophic cardiomyopathy. Hypertrophic cardiomyopathy is a genetic condition that causes thickened heart muscle. This condition can lead to sudden collapse during exertion. The murmur gets louder with Valsalva because of reduced preload. A 60-year-old woman with sudden tearing chest pain radiating to the back should be evaluated for A. Acute pericarditis. B. Aortic dissection. C. Pulmonary embolism. D. Stable angina. Correct answer B. Aortic dissection. Aortic dissection presents with sudden severe tearing pain often felt in the chest and back. It is a medical emergency. This is a life-threatening condition where the inner layer of the aorta tears, causing a sudden severe pain often described as a tearing or ripping sensation that radiates to the back. Prompt diagnosis and treatment are crucial to prevent catastrophic complications. Which class of drug is most effective in reducing mortality after myocardial infarction? A. Beta blockers. B. Calcium channel blockers. C. Nitrates. D. Loop diuretics. Correct answer A. Beta blockers. Beta blockers reduce heart rate and oxygen demand. After an MI, they help prevent arrhythmias and improve survival. They are one of the few drug classes shown to lower post-MI mortality. Which of the following findings is suggestive of cardiac tamponade? A. Widened pulse pressure. B. Pulses paradoxes. C. Loud S1. D. Continuous murmur. Correct answer B. Pulses paradoxes. Cardiac tamponade is fluid buildup in the pericardium that compresses the heart. It leads to pulses paradoxes, where systolic blood pressure drops more than 10 mmHg during inspiration. It is a medical emergency. Which valve abnormality most commonly causes atrial fibrillation? A. Pulmonary stenosis. B. Tricuspid regurgitation. C. Aortic stenosis. D. Mitral stenosis. Correct answer D. Mitral stenosis. Mitral stenosis leads to increased pressure in the left atrium, causing it to enlarge. This stretching disrupts the electrical pathways and often leads to atrial fibrillation. It's a common complication in rheumatic heart disease. What is the first line drug in acute management of bradycardia with hypotension? A. Atropine. B. Adenosine. C. Amiodarone. D. Digoxin. Correct answer A. Atropine. Atropine is the first drug used when a patient has symptomatic bradycardia, especially with low blood pressure. It works by blocking the vagus nerve, which increases heart rate. If it fails, pacing may be needed. Which antihypertensive is contraindicated in pregnancy? A. Labetalol. B. Methyl-dopa. C. Enalapril. D. Nifedipine. Correct answer C. Enalapril. ACE inhibitors like enalapril can cause fetal renal damage and are contraindicated in pregnancy. Safer alternatives include labetalol, methyl-dopa and nifedipine. Managing hypertension in pregnancy is important to avoid complications. What is the most common ECG finding in pulmonary embolism? A. ST elevation. B. S1Q3T3 pattern. C. T-wave inversion in leads 1 and AVL. D. Sinus tachycardia. Correct answer D. Sinus tachycardia. While S1Q3T3 is a classical finding, the most common ECG change in pulmonary embolism is simply sinus tachycardia. It reflects the body's response to low oxygen and strain on the right heart. The ECG may also show non-specific STT changes. Which of the following is the most common cause of myocardial infarction? A. Coronary artery spasm. B. Coronary embolism. C. Atherosclerotic plaque rupture. D. Vasculitis. Correct answer C. Atherosclerotic plaque rupture. Most heart attacks are caused by the rupture of an atherosclerotic plaque in a coronary artery. This triggers clot formation and sudden blockage of blood flow. The affected heart muscle becomes ischemic and may die if not treated quickly. Which of the following drugs is known to prolong the QT interval? A. Metoprolol, B. Furosemide, C. Azithromycin, D. Enalapril. Correct answer C. Azithromycin. Azithromycin is a macrolide antibiotic that can prolong the QT interval on ECG. This increases the risk of torsi de pontis, a serious arrhythmia. Caution is needed, especially in patients with other risk factors. A 65-year-old man presents with chest pain relieved by rest. ECG is normal. What is the most likely diagnosis? A. Unstable angina, B. Stable angina, C. Myocardial infarction, D. Pericarditis. Correct answer B. Stable angina. Stable angina occurs because narrowed heart arteries can't supply enough oxygen when the heart works harder during activity, leading to discomfort. The pain is relieved by rest because the heart's demand for oxygen decreases, easing the strain on its blood supply. A normal ECG taken while at rest is common in stable angina, as abnormalities often only appear when the heart is stressed. His age is a significant factor, increasing the likelihood of narrowed arteries that cause such symptoms. ST elevation in leads 2, 3 and AVF indicates infraction in which area of the heart? A. Anterior wall, B. Lateral wall, C. Inferior wall, D. Posterior wall. Correct answer C. Inferior wall. ST elevation in ECG leads 2, 3 and AVF points to acute injury of the heart's inferior wall, strongly indicating a myocardial infarction in that area, that is heart attack. This is typically caused by a blocked coronary artery and represents a critical medical emergency needing immediate treatment. A 55-year-old with orthopnea and paroxysmal nocturnal dyspnea likely has which condition? A. Asthma, B. COPD, C. Left-sided heart failure, D. Pulmonary embolism. Correct answer C. Left-sided heart failure. Left heart failure causes pulmonary congestion, leading to breathlessness when lying down. Orthopnea and paroxysmal nocturnal dyspnea are classic signs. These symptoms improve when the patient sits or stands upright. A patient with a mid-systolic murmur at the right second intercostal space radiating to the neck most likely has A. Mitral regurgitation, B. Aortic stenosis, C. Pulmonary stenosis, D. Hypertrophic cardiomyopathy. Correct answer B. Aortic stenosis. Aortic stenosis produces a harsh mid-systolic murmur heard best at the right upper sternal border. It typically radiates to the carotids. Patients may also have symptoms like syncope, angina, and dyspnea on exertion. Which drug is contraindicated in inferior wall myocardial infarction with right ventricular involvement? A. Aspirin. B. Nitroglycerin. C. Clopidogrel. D. Heparin. Correct answer B. Nitroglycerin. In right ventricular infarction, preload is crucial to maintain cardiac output. Nitroglycerin reduces preload and can worsen hypotension. Fluids are usually given to support circulation in such cases. Which of the following is the earliest sign of cardiac tamponade on echocardiography? A. Right atrial collapse. B. Pericardial effusion. C. Left ventricular hypertrophy. D. Aortic root dilation. Correct answer A. Right atrial collapse. In cardiac tamponade, fluid compresses the heart chambers. The right atrium, being a low pressure chamber, collapses first during diastole. Echocardiography is the key tool to diagnose cardiac tamponade early. A patient has palpitations and an irregularly irregular pulse. What is the most likely diagnosis? A. Sinus tachycardia. B. Atrial fibrillation. C. Supraventricular tachycardia. D. Ventricular tachycardia. Correct answer B. Atrial fibrillation. Atrial fibrillation presents with an irregularly irregular rhythm due to chaotic electrical activity in the atria. It may cause palpitations, fatigue, or even stroke. Pulse and ECG are important for diagnosis. A patient presents with chest pain, pericardial friction rub, and diffuse ST elevation on ECG. What is the most likely diagnosis? A. Myocardial infarction. B. Pulmonary embolism. C. Pericarditis. D. Aortic dissection. Correct answer C. Pericarditis. Pericarditis causes sharp chest pain that may improve when leaning forward. The pericardial friction rub is a classic finding. ECG typically shows diffuse ST elevation and PR depression, unlike localized changes in MI. Which drug is used to break up clots during an acute ST elevation myocardial infarction if PCI is not available? A. Heparin. B. Clopidogrel. C. Streptokinase. D. Propranolol. Correct answer C. Streptokinase. PCI stands for percutaneous coronary intervention, angioplasty. Streptokinase is a thrombolytic agent used to dissolve clots in acute STEMI when PCI is not available. It helps restore blood flow to the heart. It's most effective when given early after symptom onset. Which medication helps reduce fluid buildup in patients with heart failure? A. Beta blockers. B. Statins. C. Anticoagulants. D. Diuretics. And the correct answer is D. Diuretics. Diuretics help reduce fluid buildup in heart failure patients by increasing urine production. This process removes excess fluid from the body. As a result, it decreases the strain on the heart and helps alleviate symptoms like swelling and shortness of breath. Which condition involves the underdevelopment of the left side of the heart? A. Coarctation of the aorta. B. Tetralogy of Fallot. C. Hypoplastic left heart syndrome. D. Transposition of the great arteries. And the correct answer is C. Hypoplastic left heart syndrome. Hypoplastic left heart syndrome is a rare heart defect present at birth. That is, it is congenital. In this condition, the left side of the heart is extremely underdeveloped. If a baby is born with hypoplastic left heart syndrome, the left side of the heart can't pump blood well. Which of the following procedure is commonly performed to correct transposition of the great arteries in newborns? A. Balloon atrial septostomy. B. Fontaine procedure. C. Norwood procedure. D. Arterial switch operation. And the correct answer is D. Arterial switch operation. The procedure commonly performed to correct transposition of the great arteries in newborns is called the arterial switch operation. This operation is also known as Zatten procedure or Zatten switch procedure. This surgery switches the positions of the major arteries to their correct locations. Which procedure is used to repair or replace the aortic valve without open heart surgery? A. Percutaneous coronary intervention PCI. B. Transcatheter aortic valve replacement TAVR. C. Coronary artery bypass grafting CABG. D. Pacemaker implantation. And the correct answer is B. Transcatheter aortic valve replacement TAVR. The procedure used to repair or replace the aortic valve without open heart surgery is called transcatheter aortic valve replacement TAVR. This procedure involves inserting a new valve via a catheter through a blood vessel, often accessed through the groin. This method avoids the need for open heart surgery and allows for quicker recovery. Which of the following syndrome is associated with congenital heart defects, abnormal facial features, and learning difficulties? A. Marfan syndrome. B. Down syndrome. C. Noonan syndrome. D. Turner syndrome. And the correct answer is C. Noonan syndrome. Noonan syndrome is a genetic condition that can cause a variety of symptoms. It often leads to heart defects, distinct facial features, and difficulties with learning. People with this syndrome might also be shorter than average and have issues with bleeding. It results from changes in specific genes. Which medication is used to prevent the formation of new blood clots? A. Beta blockers. B. Anticoagulants. C. Diuretics. D. Statins. And the correct answer is B. Anticoagulants. Anticoagulants prevent the formation of new blood clots by thinning the blood. This helps to maintain smooth blood flow through the heart and blood vessels. By stopping clots from forming, anticoagulants reduce the risk of blockages that can lead to heart attacks or strokes. This is particularly important for people with conditions like atrial fibrillation, deep vein thrombosis, or after certain surgeries. Which type of fat is considered heart healthy and is found in olive oil and avocados? A. Saturated fat. B. Trans fat. C. Monounsaturated fat. D. Polyunsaturated fat. And the correct answer is C. Monounsaturated fat. Monounsaturated fats found in olive oil and avocados are considered heart healthy because they help reduce bad cholesterol levels in the blood. That is, they help lower the LDL levels in the blood. Lowering LDL cholesterol can decrease the risk of heart disease and stroke. These fats also provide essential nutrients and antioxidants that protect the heart and blood vessels. Including monounsaturated fats in your diet can improve overall cardiovascular health. Which immediate treatment is crucial for a person experiencing sudden cardiac arrest? A. CPR and defibrillation. B. Beta blockers. C. Angioplasty. D. Coronary artery bypass grafting. CABG. And the correct answer is A. CPR and defibrillation. CPR and defibrillation are immediate treatments for sudden cardiac arrest because they can save a person's life by restoring normal heart rhythm and blood flow. CPR helps maintain blood circulation to vital organs by manually pumping the heart. Defibrillation delivers an electric shock to the heart which can reset the heart's rhythm back to normal. Quick action with CPR and defibrillation significantly increases the chances of survival and recovery. Which cardiac procedure involves inserting a catheter into the heart through a vein or artery to diagnose and treat heart conditions? A. Angioplasty. B. Valve replacement. C. Cardiac catheterization. D. Stent replacement. And the correct answer is C. Cardiac catheterization. Cardiac catheterization is considered a procedure that involves inserting a catheter into the heart through a vein or artery to diagnose and treat heart conditions because it allows doctors to directly assess the heart and blood vessels. This procedure helps in diagnosing issues like blocked arteries, heart defects, and measuring pressures within the heart. This procedure can also be used for treatments such as opening blocked arteries or repairing heart defects. Other names for this procedure include coronary angiography and cardiac cath. Which dietary component is important for heart health due to its role in reducing bad cholesterol? A. Saturated fats. B. Trans fats. C. Fiber. D. Sodium. And the correct answer is C. Fiber. Fiber is considered important for heart health because it helps reduce bad cholesterol levels in the blood. That is, it helps reduce the LDL levels in the blood. Soluble fiber in particular binds to cholesterol in the digestive system, preventing it from being absorbed into the bloodstream. This helps lower overall cholesterol levels. reducing the risk of heart disease. Additionally, fiber can help regulate blood sugar levels and promote a healthy weight, both of which are beneficial for heart health. What is the recommended amount of moderate intensity exercise per week for heart health? A. 60 minutes, B. 90 minutes, C. 150 minutes, D. 200 minutes. And the correct answer is C. 150 minutes. 150 minutes of moderate intensity exercise per week is recommended for heart health because it helps improve cardiovascular fitness, lower blood pressure, and reduce bad cholesterol levels. Regular exercise strengthens the heart muscle, allowing it to pump more blood efficiently. It also helps maintain a healthy weight, manage stress, and improve overall well being. This amount of exercise is associated with a reduced risk of heart disease and other chronic conditions. Which habit is most beneficial in reducing the risk of heart disease? A. Smoking cessation, B. High sugar diet, C. Excessive alcohol consumption, D. Skipping meals. And the correct answer is A. Smoking cessation. Quitting smoking is considered highly beneficial in reducing the risk of heart disease because smoking damages the heart and blood vessels. It contributes to the buildup of plaque in arteries, which can lead to blockages, heart attacks, and strokes. Smoking also raises blood pressure and reduces oxygen in the blood, making the heart work harder. Stopping smoking improves circulation, lowers blood pressure, and decreases the risk of developing heart disease. What is the function of the pericardium? A. Pumps blood throughout the body. B. Supplies the heart muscle with blood. C. Prevents friction between the heart and surrounding structures. D. Initiates electrical impulses. And the correct answer is C. Prevents friction between the heart and surrounding structures. The pericardium serves several important functions. It protects the heart by acting as a barrier against infections and other potential threats. It also reduces friction between the heart and surrounding tissues by producing lubricating fluid. Additionally, it helps anchor the heart in the chest and limits its movement, ensuring it stays in the correct position. Which pediatric condition involves the narrowing of the aorta? A. Coarctation of the aorta. B. Transposition of the great arteries. C. Hypoplastic left heart syndrome. D. Tricuspid atresia. And the correct answer is A. Coarctation of the aorta. Coarctation of the aorta is a congenital defect where a child's aorta is narrowed, leading to poor blood flow. This can cause symptoms like difficulty breathing, poor feeding, and high blood pressure in the upper body. Treatment usually involves surgery or procedures to widen the narrowed area to ensure proper blood flow and prevent complications. Which genetic condition can lead to higher levels of cholesterol and early heart disease? A. Hypertension, B. Familial hypercholesterolemia. C. Marfan syndrome. D. Hemophilia. And the correct answer is B. Familial hypercholesterolemia. Familial hypercholesterolemia is a genetic condition causing very high levels of LDL cholesterol, that is bad cholesterol. This increases the risk of heart disease at a young age. It is often inherited from parents who also have high cholesterol. Treatment includes lifestyle changes and medications to lower cholesterol levels. Which inflammatory marker is often measured to assess heart disease risk? A. C-reactive protein. B. Albumin. C. Ferritin. D. Bilirubin. And the correct answer is A. C-reactive protein, CRP. C-reactive protein, CRP is often measured to assess heart disease risk because it is a marker of inflammation in the body. Elevated levels of CRP can indicate inflammation in the arteries, which is a risk factor for atherosclerosis, that is plaque buildup in the arteries. High CRP levels have been associated with an increased risk of heart attacks and other cardiovascular events. Measuring CRP levels helps doctors evaluate a patient's risk of heart disease and guide prevention and treatment strategies. Which device is implanted to help the heart pump blood in patients with severe heart failure? A. Pacemaker. B. Defibrillator. C. Ventricular assist device VAD. D. Stent. And the correct answer is C. Ventricular assist device VAD. A ventricular assist device is implanted to help the heart pump blood in patients with severe heart failure. It takes over the pumping function of the weakened heart, improving blood flow to the body. This helps alleviate symptoms of heart failure, such as fatigue and shortness of breath. VADs can be used as a temporary measure while awaiting a heart transplant, or as a long-term solution for those not eligible for transplant. Which congenital heart defect involves a hole in the wall separating the two lower chambers of the heart? A. Atrial septal defect. B. Ventricular septal defect. C. Patent ductus arteriosus. D. Tetralogy of Fallot. And the correct answer is B. Ventricular septal defect VSD. The congenital heart defect involving a hole in the wall separating the two lower chambers of the heart is called a ventricular septal defect VSD. This defect allows oxygenated blood to mix with deoxygenated blood between the left and right ventricles. This can lead to increased blood flow to the lungs, causing respiratory issues and heart enlargement. Depending on the size and location of the hole, treatment may range from monitoring to surgical repair. Which surgical procedure is performed to create a new route around a blocked coronary artery? A. Angioplasty. B. Coronary artery bypass graft CABG. C. Valve replacement. D. Pacemaker insertion. And the correct answer is B. Coronary artery bypass graft CABG. A new route is created around a blocked coronary artery in a coronary artery bypass graft to restore proper blood flow to the heart muscle. The blockage obstructs blood flow, depriving the heart of necessary oxygen and nutrients. By bypassing the blocked artery with a healthy blood vessel, usually taken from the leg, arm, or chest, the heart receives adequate blood supply. This procedure helps reduce symptoms like chest pain and lowers the risk of heart attacks. The right atrium receives deoxygenated blood from which of the following blood vessels? A. Pulmonary veins. B. Aorta. C. Superior and inferior vena cava. D. Coronary arteries. And the correct answer is C. Superior and inferior vena cava. The right atrium receives deoxygenated blood from the superior vena cava and the inferior vena cava. The superior vena cava brings blood from the upper parts of the body, like the head and arms. The inferior vena cava brings blood from the lower parts of the body, such as the legs and abdomen. Where does the exchange of gases and nutrients between blood and tissues occur? A. Arteries. B. Veins. C. Capillaries. D. Atria. And the correct answer is C. Capillaries. The exchange of gases and nutrients between blood and tissues occur in the capillaries. Capillaries are tiny blood vessels that connect arteries and veins and have very thin walls. These thin walls allow oxygen and nutrients to pass from the blood into the tissues and waste products to pass from the tissues into the blood. Which type of exercise is particularly beneficial for cardiovascular health? A. Weightlifting. B. Aerobic exercise. C. Yoga. D. Pilates. And the correct answer is B. Aerobic exercise. Aerobic exercise is beneficial for cardiovascular health because it strengthens the heart, making it pump blood more efficiently. It also helps lower blood pressure and improves blood flow, reducing the risk of heart disease. Additionally, aerobic exercise can help maintain a healthy weight and lower cholesterol levels, further protecting the heart. Which of the following medications is used to dissolve blood clots during a heart attack? A. Aspirin. B. Statins. C. Thrombolytics. D. Beta blockers. And the correct answer is C. Thrombolytics. Thrombolytic medications are used during a heart attack to dissolve blood clots that are blocking the coronary arteries. By clearing these clots, these medications restore blood flow to the heart muscle, which is crucial to prevent further damage and improve outcomes. This approach is aimed at quickly reopening the blocked arteries to minimize the impact of heart attack and enhance recovery. Which advanced imaging technique can measure coronary artery calcium levels to assess heart disease risk? A. Echocardiogram. B. Cardiac MRI. C. Coronary calcium scan. D. Angiogram. And the correct answer is C. Coronary calcium scan. A coronary calcium scan looks for calcium deposits in the arteries of your heart. These calcium deposits can show if you have plaque buildup, which can lead to heart disease. By measuring how much calcium you have, doctors can tell if you are at risk of heart problems and figure out the best way to keep you healthy. Which of the following device is surgically implanted to help regulate abnormal heart rhythms by delivering electrical impulses to the heart? A. Coronary stent. B. Implantable cardioverter defibrillator ICD. C. Pacemaker. D. Left ventricular assist device LVAD. And the correct answer is C. Pacemaker. A pacemaker is surgically implanted to help regulate abnormal heart rhythms. It ensures that the heart beats at a normal rate, especially when it is too slow or irregular. By delivering electrical impulses to the heart muscles, it keeps the heart functioning properly. This improves the patient's heart function and overall health. Which vessel carries oxygenated blood from the lungs to the heart? A. Pulmonary vein. B. Pulmonary artery. C. Aorta. D. Superior vena cava. And the correct answer is A. Pulmonary vein. The pulmonary veins carry oxygenated blood from the lungs to the heart. These veins deliver the oxygen-rich blood into the left atrium, from where it is pumped into the left ventricle and then circulated throughout the body. They are the only veins in the body that carry oxygenated blood. Which heart chamber has the thickest myocardium? A. Right atrium. B. Left atrium. C. Right ventricle. D. Left ventricle. And the correct answer is D. Left ventricle. The left ventricle has the thickest myocardium. This is because it needs to generate enough force to pump oxygenated blood throughout the entire body, which requires more muscle strength compared to other chambers that only pump blood to the lungs or nearby areas. Which parameter is used to assess the severity of heart failure? A. Blood pressure. B. Ejection fraction. C. Respiratory rate. D. Body mass index. And the correct answer is B. Ejection fraction. Ejection fraction is used to assess the severity of heart failure because it measures the percentage of blood that the left ventricle pumps out with each contraction. A normal ejection fraction indicates the heart is pumping effectively, while a low ejection fraction suggests that the heart is not pumping enough blood to meet the body's needs. This parameter helps doctors determine the extent of heart dysfunction and guide treatment decisions. Which of the following heart valve is located between the right ventricle and pulmonary artery? A. Mitral valve. B. Tricuspid valve. C. Pulmonary valve. D. Aortic valve. And the correct answer is C. Pulmonary valve. The pulmonary valve is located between the right ventricle and the pulmonary artery. Which lifestyle factor is not typically associated with an increased risk of heart disease? A. Smoking. B. Sedentary lifestyle. C. Healthy diet. D. High stress levels. And the correct answer is C. Healthy diet. A healthy diet is good for your heart and helps prevent heart disease. Whereas smoking, not exercising, or being stressed increases the risk of heart disease. Which type of cholesterol is considered good cholesterol? A. LDL, B. HDL, C. VLDL, D. Triglycerides. And the correct answer is B. HDL. HDL or high density lipoprotein is considered good cholesterol because it helps remove excess cholesterol from the bloodstream and tissues, transporting it to the liver for excretion. This process reduces the buildup of plaque in the arteries, thereby lowering the risk of heart disease and stroke. Which dietary change is recommended for reducing the risk of heart disease? A. Increasing saturated fat intake. B. Reducing sodium intake. C. Eliminating fruits and vegetables. D. Increasing red meat consumption. And the correct answer is B. Reducing sodium intake. Reducing sodium intake lowers the risk of heart disease by helping to reduce blood pressure. High sodium levels can cause the body to retain excess water, increasing the volume of blood and consequently blood pressure. Lower blood pressure reduces the strain on the heart and arteries, decreasing the risk of heart attacks and other cardiovascular diseases. Which of the following is the drug of choice for angina pectoris? A. Aspirin, B. Nitroglycerin, C. Atorvastatin, D. Furosemide. And the correct answer is B. Nitroglycerin. Nitroglycerin is the drug of choice for angina pectoris because it effectively dilates blood vessels, improving blood flow to the heart. This vasodilation reduces the heart's workload and oxygen demand, relieving the chest pain associated with angina. Additionally, nitroglycerin works quickly, providing rapid relief from symptoms. Which procedure uses high frequency electrical energy to destroy abnormal heart tissue? A. Angioplasty, B. Ablation, C. Valve replacement, D. Pacemaker insertion. And the correct answer is B. Ablation. Ablation procedure is also called radiofrequency ablation or catheter ablation. This procedure uses high frequency electrical energy to destroy abnormal heart tissue that is causing irregular heartbeats or arrhythmias. The purpose is to restore a normal heart rhythm. Beta blockers are primarily used to treat which condition? A. Diabetes, B. Hypertension and arrhythmias, C. Hyperlipidemia, D. Asthma. And the correct answer is B. Hypertension and arrhythmias. Beta blockers make the heartbeat slower. This helps lower blood pressure. They also reduce how hard the heart works. This makes it easier for the heart to pump blood. And for irregular heartbeats, they help maintain a steady rhythm. Which of the following medication is a statin used to lower cholesterol levels? A. Metoprolol, B. Lisinopril, C. Atorvastatin, D. Warfarin. And the correct answer is C. Atorvastatin. Atorvastatin lowers cholesterol levels by blocking an enzyme called HMG-CoA reductase, which the liver uses to produce cholesterol. This leads to a reduction in the amount of cholesterol made by the liver. It also helps the liver remove more LDL cholesterol, that is bad cholesterol, from the blood. The left ventricle pumps blood into which major artery? A. Pulmonary artery, B. Aorta, C. Superior vena cava, D. Inferior vena cava. And the correct answer is B. Aorta. The left ventricle pumps blood into the aorta, which is the major artery responsible for distributing oxygen-rich blood throughout the body. Which structure separates the right and left ventricles? A. Interatrial septum, B. Interventricular septum, C. Coronary sulcus, D. Atrioventricular septum. And the correct answer is B. Interventricular septum. The structure that separates the right and left ventricles is called the interventricular septum. This muscular wall prevents the mixing of oxygen-rich blood in the left ventricle with the oxygen-poor blood in the right ventricle. The tricuspid valve is located between which two structures? A. Right atrium and right ventricle, B. Left atrium and left ventricle, C. Right ventricle and pulmonary artery, D. Left ventricle and aorta. And the correct answer is A. Right atrium and right ventricle. The tricuspid valve is located between the right atrium and the right ventricle. It regulates blood flow from the right atrium to the right ventricle, preventing backflow when the ventricle contracts. The T wave on an ECG represents A. Atrial depolarization, B. Ventricular depolarization, C. Atrial repolarization, D. Ventricular repolarization. And the correct answer is D. Ventricular repolarization. The T wave on an ECG shows the heart's ventricles getting back to their resting state after pumping blood. It is the recovery phase before the next heartbeat. Which of the following effects does the parasympathetic nervous system have on heart rate? A. Increases heart rate, B. Decreases heart rate, C. Has no effect on heart rate, D. Fluctuates heart rate. And the correct answer is B. Decreases heart rate. The parasympathetic nervous system decreases the heart rate by releasing a neurotransmitter called acetylcholine. Acetylcholine acts on the heart's pacemaker cells to slow down their activity, leading to a slower heart rate. Which factor primarily determines the preload of the heart? A. Heart rate. B. Blood pressure. C. Venous return. D. Stroke volume. And the correct answer is C. Venous return. Venous return is the amount of blood that comes back to the heart. It determines preload because more returning blood means the heart fills up more before it pumps. Which type of cardiomyopathy is characterized by a thickened ventricular wall? A. Arrhythmogenic right ventricular cardiomyopathy. B. Hypertrophic cardiomyopathy. C. Restrictive cardiomyopathy. D. Dilated cardiomyopathy. And the correct answer is B. Hypertrophic cardiomyopathy. In hypertrophic cardiomyopathy, the walls of the heart's ventricles become thicker than normal. This happens because the heart muscle cells grow too much, making it harder for the heart to pump blood. Which condition is characterized by the inability of the heart to pump sufficiently to meet the body's needs? A. Myocardial infarction. B. Heart failure. C. Hypertension. D. Atrial fibrillation. And the correct answer is B. Heart failure. Heart failure is when the heart can't pump enough blood to meet the body's needs. This can cause symptoms like shortness of breath, fatigue, and swelling in the legs. Which congenital heart defect involves a hole in the septum between the heart's two upper chambers? A. Ventricular septal defect. B. Atrial septal defect. C. Patent ductus arteriosus. D. Tetralogy of Fallot. And the correct answer is B. Atrial septal defect. A hole in the septum between the heart's two upper chambers is called an atrial septal defect, ASD. It is a congenital condition, meaning it is present at birth. This hole allows blood to flow between the left and right atria, which can lead to various health issues if not treated. Which condition involves inflammation of the sac surrounding the heart? A. Endocarditis. B. Myocarditis. C. Pericarditis. D. Cardiomyopathy. And the correct answer is C. Pericarditis. The condition involving inflammation of the sac surrounding the heart is called pericarditis. This can cause chest pain and other symptoms, and it may result from infections, injuries, or other medical conditions. Which organization provides guidelines for cardiovascular health? A. WHO. B. CDC. C. AHA. D. NIH. And the correct answer is C. AHA. The American Heart Association AHA provides guidelines for cardiovascular health. The AHA offers recommendations on diet, exercise, and lifestyle changes to help prevent and manage heart disease and related conditions. The DASH diet is specifically designed to combat which condition? A. Diabetes, B. Hypertension, C. Hyperlipidemia, D. Heart failure. And the correct answer is B. Hypertension. The DASH diet, which stands for Dietary Approaches to Stop Hypertension, is designed to help lower high blood pressure. Its purpose is to reduce sodium intake and promote the consumption of foods rich in nutrients like potassium, calcium, and magnesium, which help to control blood pressure. Which of the following is a lifestyle modification recommended for patients with heart disease? A. High sodium diet, B. Regular physical activity, C. Smoking, D. Sedentary lifestyle. And the correct answer is B. Regular physical activity. Regular physical activity helps strengthen the heart and improves its efficiency. It lowers blood pressure and cholesterol levels, reducing risk of further heart issues. Exercise also aids in weight management and reduces stress, which benefits overall heart health. What is the primary purpose of a defibrillator? A. To monitor blood pressure, B. To restore a normal heart rhythm, C. To reduce heart rate, D. To increase cardiac output. And the correct answer is B. To restore a normal heart rhythm. A defibrillator restores a normal heart rhythm by sending an electrical shock to the heart. This shock momentarily stops the chaotic electrical signals causing the irregular heartbeat. By doing so, it gives the heart a chance to reset and resume its natural regular rhythm. A stent is used to A. Open narrowed or blocked blood vessels, B. Repair damaged heart tissue, C. Replace heart valves, D. Monitor heart rhythms. And the correct answer is A. Open narrowed or blocked blood vessels. A stent is a small mesh tube used to treat narrowed or blocked blood vessels. During a procedure called angioplasty, a stent is placed into the affected artery. It is expanded using a balloon catheter, which opens the artery and restores normal blood flow. Then the stent stays in place to keep the artery open. Which medication is an anticoagulant often prescribed to patients with atrial fibrillation? A. Atorvastatin, B. Warfarin, C. Metoprolol, D. Lisinopril. And the correct answer is B. Warfarin. Warfarin is often prescribed to patients with atrial fibrillation because it helps prevent blood clots. In atrial fibrillation, the irregular heart rhythm can cause blood to pool in the heart, increasing the risk of clot formation. These clots can travel to the brain and cause a stroke. So, warfarin thins the blood to reduce this risk. ACE inhibitors are primarily used to treat which condition? A. Arrhythmias, B. Hypertension, C. Hyperlipidemia, D. Pericarditis. And the correct answer is B. Hypertension. ACE inhibitors treat hypertension by blocking a specific enzyme that causes blood vessels to tighten. Thus, by the action of ACE inhibitors, relaxation of blood vessels takes place, which leads to lower blood pressure. Which diagnostic method measures the electrical activity of the heart over a 24-hour period? A. Holter monitor, B. ECG, C. Stress test, D. Electrocardiogram. And the correct answer is A. Holter monitor. A Holter monitor is a portable device used to continuously monitor the electrical activity of the heart over a period of 24 to 48 hours or even longer. It consists of electrodes placed on the chest, connected to a recording device worn on the waist or shoulder. The monitor records the heart's electrical signals during normal daily activities, helping doctors detect abnormal heart rhythms or episodes of arrhythmia that may not be captured during a standard ECG test. Which diagnostic tool is most useful for assessing valve function? A. ECG, B. Echocardiogram, C. Chest X-ray, D. Cardiac MRI. And the correct answer is B. Echocardiogram. An echocardiogram is highly useful for assessing valve function because it provides real-time images of the heart and its valves using ultrasound waves. Which of the following physical exam finding is most indicative of right-sided heart failure? A. Crackles in the lungs, B. Jugular venous distension, C. S3 heart sound, D. Hypertension. And the correct answer is B. Jugular venous distension. Jugular venous distension, where the jugular veins appear visibly swollen in the neck, indicates right-sided heart failure. This occurs because the heart's weakened right ventricle fails to pump blood effectively, causing blood to back up into the veins, leading to their visible swelling. In an ECG, which segment is used to diagnose myocardial ischemia? A. PR interval, B. QRS complex, C. ST segment, D. T wave. And the correct answer is C. ST segment. The ST segment on an electrocardiogram is used to diagnose myocardial ischemia by its deviation from the baseline. During myocardial ischemia, the affected heart muscle doesn't receive enough oxygen, causing changes in the ST segment of the ECG. Specifically, it can become elevated or depressed, indicating abnormal electrical activity in the heart muscle. These changes help doctors identify and diagnose myocardial ischemia and determine the severity of the condition. Which diagnostic criterion is used to define heart failure? A. Elevated blood pressure, B. Reduced ejection fraction, C. Increased respiratory rate, D. Enlarged left atrium. And the correct answer is B. Reduced ejection fraction. Reduced ejection fraction means the heart doesn't push out enough blood each time it beats. Doctors use tests like echocardiography to measure how well the heart is pumping. When ejection fraction is low, it shows the heart is weak and can lead to heart failure. Which is the most common symptom of coronary artery disease? A. Dyspnea, B. Edema, C. Chest pain, D. Palpitations. And the correct answer is C. Chest pain. Chest pain is the most common symptom of coronary artery disease because it occurs when the heart muscle doesn't get enough blood due to narrowed or blocked arteries. This lack of blood flow, usually during physical exertion or stress, causes discomfort or pain in the chest known as angina. Which surgical procedure is used to replace a damaged heart valve? A. Angioplasty, B. CABG, C. Valve replacement, D. Pacemaker insertion. And the correct answer is C. Valve replacement. Valve replacement is necessary when a heart valve is damaged, causing symptoms like shortness of breath or fatigue. Replacing the valve improves blood flow through the heart and relieves these symptoms. Which layer of the heart wall is responsible for the pumping action of the heart? A. Endocardium, B. Myocardium, C. Epicardium, D. Pericardium. And the correct answer is B. Myocardium. The myocardium is the layer of the heart wall responsible for its pumping action. It is composed of cardiac muscle tissue that contracts to propel blood out of the heart chambers. Which lifestyle modification is least likely to reduce the risk of heart disease? A. Smoking cessation, B. Regular physical activity, C. High sodium diet, D. Healthy diet. And the correct answer is C. High sodium diet. A high sodium diet does not reduce the risk of heart disease. It actually increases it. Consuming too much sodium can lead to high blood pressure, which raises the risk of heart attacks and strokes. Which non-invasive method is commonly used to treat narrowed coronary arteries? A. Coronary artery bypass graft, B. Angioplasty, C. Valve replacement, D. Heart transplant. And the correct answer is B. Angioplasty. Angioplasty is the non-invasive method commonly used to treat narrowed coronary arteries. Angioplasty is also known as percutaneous coronary intervention (PCI) and balloon angioplasty. This procedure involves using a balloon to widen the artery and placing a stent to keep it open, improving blood flow to the heart. CABG stands for A. Coronary artery bypass graft, B. Carotid artery bypass graft, C. Coronary artery ballooning graft, D. Carotid artery ballooning graft. And the correct answer is A. Coronary artery bypass graft. Coronary artery bypass grafting is used to improve blood flow to the heart in individuals with severe coronary artery disease. It involves grafting a blood vessel from another part of the body to bypass blocked or narrowed coronary arteries, thereby restoring adequate blood flow to the heart muscle. Which of the following medication is a common beta blocker used in heart disease? A. Lisinopril, B. Metoprolol, C. Amlodipine, D. Atorvastatin. And the correct answer is B. Metoprolol. Metoprolol is a common beta blocker used in heart disease. Metoprolol is used to treat high blood pressure, angina, and heart failure. It works by reducing the heart rate and the heart's workload, helping to prevent heart attacks and improve heart function. Echocardiography is primarily used to assess A. Structure and function of the heart, B. Blood pressure, C. Blood glucose levels, D. Both B and C. And the correct answer is A. Structure and function of the heart. Echocardiography is primarily used to assess the structure and function of the heart. It provides detailed images of the heart's chambers, valves, walls, and blood vessels, helping to diagnose and monitor various heart conditions. Which biomarker is most specific for myocardial infarction? A. C-reactive protein, CRP, B. Troponin, C. Brain natriuretic peptide, BNP, D. Myoglobin. And the correct answer is B. Troponin. Troponin is the biomarker most specific for myocardial infarction, heart attack. Elevated levels of troponin in the blood indicate damage to the heart muscle. Cardiac output is the product of which of the following? A. Stroke volume and heart rate, B. Stroke volume and blood pressure, C. Heart rate and blood pressure, D. Heart rate and systemic vascular resistance. And the correct answer is A. Stroke volume and heart rate. Cardiac output is the product of heart rate, that is the number of heartbeats per minute, and stroke volume, that is the amount of blood pumped by the heart with each beat. It measures the total volume of blood the heart pumps per minute. What does the P wave on an ECG represent? A. Ventricular depolarization, B. Atrial depolarization, C. Ventricular repolarization, D. Atrial repolarization. And the correct answer is B. Atrial depolarization. The P wave on an ECG represents the depolarization of the atria, which is the electrical activity that initiates the contraction of the atria, pushing blood into the ventricles. During which phase of the cardiac cycle does the heart fill with blood? A. Systole, B. Diastole, C. Isovolumetric contraction, D. Isovolumetric relaxation. And the correct answer is B. Diastole. The heart fills the blood during the diastole phase of the cardiac cycle. During diastole, the ventricles relax and the atrioventricular valves open, allowing blood to flow from the atria into the ventricles. Which arteries supplies blood to the heart muscle itself? A. Pulmonary artery, B. Coronary arteries, C. Aorta, D. Carotid arteries. And the correct answer is B. Coronary arteries. The coronary arteries supply blood to the muscle of the heart itself. These include the left coronary artery, which branches into the left anterior descending and circumflex arteries, and the right coronary artery. The mitral valve is located between which two structures? A. Right atrium and right ventricle, B. Left atrium and left ventricle, C. Right ventricle and pulmonary artery, D. Left ventricle and aorta. And the correct answer is B. Left atrium and left ventricle. The mitral valve, also known as the bicuspid valve or left atrioventricular valve, is located between the left atrium and the left ventricle of the heart. Which hormone is known to increase heart rate and cardiac output during stress? A. Insulin, B. Glucagon, C. Epinephrine, that is adrenaline, D. Cortisol. And the correct answer is C. Epinephrine, adrenaline. Epinephrine, also known as adrenaline, is the hormone that increases heart rate and cardiac output during stress. It is released by the adrenal glands in response to stressful situations. This hormone prepares the body for a fight or flight response by enhancing blood flow to muscles and vital organs. Which of the following ions plays a crucial role in the electrical activity of the heart? A. Sodium, B. Potassium, C. Calcium, D. All of the above. And the correct answer is D. All of the above. The ions that play a crucial role in the electrical activity of the heart are sodium, potassium, and calcium. Sodium and calcium ions are crucial for the initiation and propagation of the action potential that triggers heart contractions. Whereas potassium ions are essential for repolarizing the heart cells, helping to reset electrical state of the heart after each beat. Which heart sound is associated with the closure of the atrioventricular valves? A. S1 lub, B. S2 dub, C. S3, D. S4. And the correct answer is A. S1 lub. The lub sound, known as the first heart sound, is associated with the closure of atrioventricular valves, that is, the mitral and tricuspid valves. Which of the following best describes the location of the heart? A. In the left lung, B. In the right lung, C. In the mediastinum, D. In the abdomen. And the correct answer is C. In the mediastinum. The heart is located in the mediastinum, a central compartment in the thoracic cavity. The mediastinum houses the heart along with other vital structures such as the esophagus, trachea, thymus, and other major blood vessels. Which component of blood is primarily responsible for immune response? A. Red blood cells. B. White blood cells. C. Platelets. D. Plasma. And the correct answer is B. White blood cells. White blood cells, also known as leukocytes, are responsible for protecting your body from infection. As part of your immune system, white blood cells circulate in your blood and respond to injury or illness. Which of the following best describes the function of capillaries in the cardiovascular system? A. To carry oxygenated blood from the heart to the body. B. To carry deoxygenated blood from the body to the heart. C. To facilitate the exchange of nutrients, gases and waste products. D. To store blood and regulate blood pressure. And the correct answer is C. To facilitate the exchange of nutrients, gases and waste products. Capillaries are tiny blood vessels with thin walls that allow oxygen, nutrients and waste products to pass between the blood and the body's cells. This exchange is crucial for delivering essential substances to cells and removing waste products from them. Which of the following is the outermost layer of the heart wall? A. Endocardium. B. Myocardium. C. Epicardium. D. Pericardium. And the correct answer is C. Epicardium. The outermost layer of the heart wall is the epicardium. Its function is to provide a protective layer and to produce lubricating fluid that reduces friction between the heart and surrounding structures during heartbeats. Which component of the electrocardiogram represents ventricular depolarization? A. P wave. B. QRS complex. C. T wave. D. U wave. And the correct answer is B. QRS complex. The QRS complex in an electrocardiogram represents ventricular depolarization. This phase signifies the electrical activity that causes the ventricles to contract and pump blood out to the body and lungs. What is the primary function of the lymphatic system in relation to the cardiovascular system? A. To transport oxygen. B. To remove carbon dioxide. C. To return excess tissue fluid to the bloodstream. D. To produce red blood cells. And the correct answer is C. To return excess tissue fluid to the bloodstream. The lymphatic system collects excess fluid from tissues and returns it to the bloodstream, helping to maintain balance in the body. This process prevents tissue swelling and ensures that blood volume and pressure are regulated properly within the cardiovascular system. Which of the following statements about veins is true? A. They always carry oxygenated blood. B. They have thicker walls than arteries. C. They have walls to prevent backflow of blood. D. They carry blood away from the heart. And the correct answer is C. They have walls to prevent backflow of blood. Veins have walls that prevent the backflow of blood, ensuring it moves toward the heart. These walls are crucial, especially in the legs, to counteract the effects of gravity and help maintain proper circulation. Which part of the brain regulates heart rate? A. Cerebellum, B. Hypothalamus, C. Medulla oblongata, D. Thalamus. And the correct answer is C. Medulla oblongata. The medulla oblongata, a part of the brainstem, regulates heart rate. Medulla oblongata controls the autonomic nervous system, which adjusts the heart rate in response to the body's needs. The volume of blood pumped out of the heart's left ventricle during each systolic cardiac contraction is called A. Cardiac output, B. Stroke volume, C. End diastolic volume, D. Ejection fraction. And the correct answer is B. Stroke volume. Stroke volume is the amount of blood pumped by the left ventricle of the heart with each beat. It is a key factor in determining cardiac output, which is the overall blood flow from the heart. Which of the following best describes an artery? A blood vessel that carries blood away from the heart. B. A blood vessel that carries blood toward the heart. C. A blood vessel that carries only deoxygenated blood. D. Blood vessel that has walls to prevent backflow. And the correct answer is A blood vessel that carries blood away from the heart. Arteries are the blood vessels that carries blood away from the heart. Which of the following is not a component of the cardiovascular system? A. Heart, B. Blood vessels, C. Blood, D. Lymph nodes. And the correct answer is D. Lymph nodes. Heart, blood vessels and blood are all components of cardiovascular system, whereas lymph nodes are not a component of cardiovascular system. What is the main function of the valves in the heart? A. To maintain blood pressure, B. To prevent the backflow of blood, C. To increase the speed of blood flow, D. To filter blood impurities. And the correct answer is B. To prevent the backflow of blood. The main function of the heart valves is to ensure unidirectional blood flow through the heart. The right side of the heart is responsible for which of the following? A. Pumping oxygenated blood to the body. B. Pumping deoxygenated blood to the lungs. C. Pumping oxygenated blood to the lungs. D. Pumping deoxygenated blood to the body. And the correct answer is B. Pumping deoxygenated blood to the lungs. The right side of the heart is responsible for pumping deoxygenated blood to the lungs. Which of the following conditions is characterized by narrowing of the coronary arteries? A. Hypertension, B. Atherosclerosis, C. Myocarditis, D. Arrhythmia. And the correct answer is B. Atherosclerosis. The narrowing of coronary arteries in atherosclerosis is primarily due to the buildup of plaque. Plaque is made up of fat, cholesterol, calcium and other substances found in the blood. Over time, this plaque hardens and narrows the arteries, reducing blood flow to the heart muscle. This process is called atherosclerosis, and it can lead to serious conditions such as heart attacks and strokes. Which blood vessel carries oxygen-rich blood from the lungs to the heart? A. Pulmonary artery. B. Pulmonary vein. C. Aorta. D. Superior vena cava. And the correct answer is B. Pulmonary vein. Pulmonary vein carries oxygen-rich blood from the lungs to the heart. What is the primary role of hemoglobin in red blood cells? A. To fight infections. B. To carry oxygen. C. To clot blood. D. To transport hormones. And the correct answer is B. To carry oxygen. The primary role of hemoglobin in red blood cells is to carry oxygen. What structure prevents the backflow of blood into the right atrium? A. Tricuspid valve. B. Mitral valve. C. Pulmonary valve. D. Aortic valve. And the correct answer is A. Tricuspid valve. Tricuspid valve prevents the backflow of blood into the right atrium. Which of the following blood vessels has the thickest walls? A. Capillaries. B. Veins. C. Arteries. D. Venules. And the correct answer is C. Arteries. Arteries are the blood vessels that has the thickest walls. They have the thickest walls of all blood vessels because they need to withstand the high pressure from the heart's pumping action. Which part of the heart's conduction system directly stimulates the ventricles to contract? A. Sinoatrial node. B. Atrioventricular node. C. Bundle of His. D. Purkinje fibers. And the correct answer is D. Purkinje fibers. The Purkinje fibers in the walls of the ventricles are the part of the heart's conduction system that directly stimulate the ventricles to contract. The Purkinje fibers receive electrical signals from the SA node, the heart's pacemaker, and transmit them more quickly to stimulate the ventricles to contract. During which phase of the cardiac cycle do the ventricles fill with blood? A. Systole. B. Diastole. C. Isovolumetric contraction. D. Isovolumetric relaxation. And the correct answer is B. Diastole. The ventricles fill with blood during the diastole phase of the cardiac cycle. What is the name of the double-walled sac that encloses the heart? A. Endocardium. B. Myocardium. C. Epicardium. D. Pericardium. And the correct answer is D. Pericardium. The double-walled sac that encloses the heart is called the pericardium. Its function is to protect the heart, anchor it within the chest cavity, and reduce friction between the heart and surrounding structures by providing a lubricated environment. Which of the following components are included in the cardiovascular system? A. Heart and blood vessels. B. Blood vessels and skin. C. Neurons and dendrites. D. None of these. And the correct answer is A. Heart and blood vessels. The cardiovascular system, also known as the circulatory system, is responsible for transporting blood, nutrients, oxygen, carbon dioxide, and hormones throughout the body. What is the main function of the cardiovascular system? A. Digestion of food. B. Regulation of body temperature. C. Transportation of blood, nutrients, and oxygen throughout the body. D. Filtration of waste products from the blood. And the correct answer is C. Transportation of blood, nutrients, and oxygen throughout the body. The main function of the cardiovascular system is the transportation of blood, nutrients, and oxygen throughout the body. Which type of blood vessels carry blood away from the heart? A. Veins. B. Capillaries. C. Arteries. D. Lymphatic vessels. And the correct answer is C. Arteries. Arteries are the blood vessels that carry blood away from the heart. What is the name of the muscular layer of the heart wall? A. Endocardium. B. Pericardium. C. Myocardium. D. Epicardium. And the correct answer is C. Myocardium. The muscular layer of the heart wall is called the myocardium. It is responsible for contracting and pumping blood out of the heart to the rest of the body. Which of the following blood vessels carries deoxygenated blood from the body back to the heart? A. Pulmonary vein. B. Aorta. C. Superior vena cava. D. Pulmonary artery. And the correct answer is C. Superior vena cava. From the options given, superior vena cava carries deoxygenated blood from the body back to the heart. Which valve prevents the backflow of blood from the left ventricle to the left atrium? A. Tricuspid valve. B. Pulmonary valve. C. Mitral valve. D. Aortic valve. And the correct answer is C. Mitral valve. The valve that prevents the backflow of blood from the left ventricle to the left atrium is the mitral valve. Mitral valve is also known as bicuspid valve. It is located between the left atrium and the left ventricle, ensuring that blood flows in one direction during the cardiac cycle. The term systole refers to A. The contraction phase of the heart. B. The relaxation phase of the heart. C. The filling of the atria. D. The filling of the ventricles. And the correct answer is A. The contraction phase of the heart. Systole refers to the phase of cardiac cycle in which the heart's ventricles contract to pump blood out of the heart. Which part of the heart is responsible for pumping deoxygenated blood to the lungs? A. Right atrium. B. Right ventricle. C. Left atrium, D. Left ventricle. And the correct answer is B. Right ventricle. Which of the following components of blood is primarily responsible for clotting? A. Red blood cells, B. White blood cells, C. Platelets, D. Plasma. And the correct answer is C. Platelets. Platelets are primarily responsible for blood clotting. They aggregate at the site of blood vessel injury and work with clotting factors to form a stable blood clot. What is the largest artery in the human body? A. Pulmonary artery, B. Coronary artery, C. Aorta, D. Femoral artery. And the correct answer is C. Aorta. The largest artery in the human body is the aorta. It originates from the left ventricle of the heart and distributes oxygen-rich blood to all parts of the body through its extensive network of branches. Which chamber of the heart receives oxygenated blood from the lungs? A. Right atrium, B. Right ventricle, C. Left atrium, D. Left ventricle. And the correct answer is C. Left atrium. The heart is primarily composed of which type of muscle tissue? A. Skeletal muscle, B. Smooth muscle, C. Cardiac muscle, D. Voluntary muscle. And the correct answer is C. Cardiac muscle. The heart is primarily composed of cardiac muscle tissue. Which of the following structures initiates the heartbeat and is known as the natural pacemaker of the heart? A. Atrioventricular node, B. Sinoatrial node, C. Bundle of His, D. Purkinje fibers. And the correct answer is drop your answers in the comment section below. For downloading PDF content and for latest updates, follow our Telegram channel. I have given the link in the description below. If you like this video, don't forget to hit that like button. Thanks for watching.